speaker is Himanshu Misra.
Hello. Yeah, I'm bringing my screen up just a minute. So, good evening, everyone. Am I audible?
You are.
Yes. So, it's a pleasure to be here. I wanted to talk about EnlitenAI that is building an artificial intelligence based SaaS platform for personalized management of seizures. We use wearables for continuous monitoring of vitals and other neurological biomarkers. So these are the problems that we address in the market today. The number one is the challenge associated with a patient or a caregiver. How is it that they can share the information specific to a particular episode with the neurologist right away? And the neurologist is rarely there at the time of the scene when a seizure or an episode happens. Today, this happens every 6 to 8 months out when there's a clinical visit. Number two problem is associated with the neurologist. The challenge is how is it that they can get access to the necessary information from a patient so that they can build a personalized care plan or a treatment plan. And today the drug titrations are extremely long and they are based on a trial and error process. And the number three problem challenge that we address is for the insurance companies. How is it that we can help them lower the cost burden associated with the care for seizures and epilepsy? Today, the cost burden is close to $37 billion, which includes indirect and direct costs. So, what's the solution? Our product is Neurolighten, which is a cloud based platform. We are not a device, we are not creating a physical sensor based medical device, but rather we have a data ingestion engine which captures data from various systems and sources. It could be the EMR or EHR systems, the smartwatches, as well as health headbands, which can deliver vitals as well as brain waves and EEG patterns on a continuous basis. And then the caregiver observations, which could be audios and videos and streaming, that can happen. And once that data gets into our cloud platform, it gets aggregated. Our AI engine creates insights that can be used for the personalized protocols, for preemptive action for the caregivers, but also equally important, the continuous insights that are generated using the data, the vitals, the physiological signs, other neurological biomarkers on a continuous basis enable the neurologist to get the right piece of information at the right time so they can create specific personalized dashboards for detection of tachyphylaxis, for guiding the drug titration, as well as to guide the aggressiveness of treatment. And all of these things require the information on a continuous basis. This is just an example of some of the interfaces that you would see if you are a patient. Of course, if you're a neurologist, you'll have a different interface, but I just wanted to share with you some of the screenshots that we have from our MVP product that is out there. On the left hand side, you see the real time data coming in from the smartwatch as well as a headband and what have you. We have various ways in which a patient can customize their dashboards and slice and dice data. And on the third image, you can see is the logging of specific events and notations at a given timestamp. And then, of course, on the right hand side, a drill down. You can go in at a particular point of time and see all the complete comprehensive panel of information which is of relevance for that particular episode. If I were to look at the competitive landscape through the lens of two key parameters, one is the personalization of care, and the second is on the connectedness, we would place Neurolighten on the top right hand quadrant. There are other players that you see. One is the purple colored stars. This is a group associated with mobile applications which are used for creating seizure diaries. And on the other side, the black colored ones, stars, are sensors and FDA cleared or approved devices which are used in the detection of seizures. And if you look at the left hand chart, our product Neurolighten goes beyond the diary creation as well as detection of seizures to a space of personalization of treatment, which is extremely useful for the patient and desired by the neurologist for personalization of care. The direct costs actually the cost burden of epilepsy for an insurance carrier is $37 billion. Our total addressable market is a subset of the direct costs associated with the direct costs, and we have corresponding to that, we have 4 million patients in the US and 16,000 neurologists. Our serviceable addressable market is a subset of those 500 neurology centers that we have associated with research departments. Also, I want to mention that of the 4 million patients, 31% of epileptic patients have refractory epilepsy, that is drug-resistant epilepsy. And those are essentially the early adopters, and those are guys who would do anything. They'll try voodoo if anything helps for managing their seizures. Of course, our serviceable obtainable market is a further subset of about 150 neurology centers that we are trying to target in the next 5 years. Our monetization strategy is based on a one-time fee as well as a monthly subscription. We have multiple streams of revenue, each associated with the neurologists or the neurosciences departments, the patients, and the insurance carriers. And each stakeholder would pay a certain fee, as I've listed out here, based on the consumption of the features and functionalities that they have accessible to them. The CPT code would be used, and insurance carriers would be the payers for each of these revenue streams. One point I'd also like to mention is there is a significant opportunity for the neurosciences departments to be able to create an alternate or a new source of revenue for being able to deliver personalized care. Our go-to-market strategy is focused on the neurology departments. Initially, the first half of this year, our focus would be on closing the clinical observation study that we have planned. UCSF is a strategic partner. We have beta customers at Colorado, Utah, as well as University of Washington, Seattle. And in the first year, we will also be working with certain insurance carriers who will be a part of the closed loop deployment of the process and create certain ROI metrics which enable them to decide their involvement and their engagement. But in the second year, 2023, insurance carriers become an active independent stream of revenue, and they help us penetrate the market in a pervasive way by reaching out to the subscriber base. Our FDA pathway, we are a class 2 medical device as per the FDA guidelines. We are working with CSSI Life Sciences as a strategic partner, and we have legal counsel with the 3 major law firms, and we also have filed a patents as well. Of course, we'll be using the generic CPT code to begin with until we get our own category 3 CPT code. These are the financials projections for the next 5 years. We become profitable towards the middle of next year. We are looking at targeting about 96, close to 100 neurosciences departments over the period of the next 5 years, and our current raise is for $3 million. In terms of our exit strategy, we anticipate with the revenue projections that we have, we will be attractive by potential acquirers, which could be represented by any combination of insurance carriers, the pharmaceutical companies, the biomedical companies, as well as the wearable OEMs. In fact, I've listed some of the comparables, and as if you can see, Philips had acquired a very close cousin to us in terms of monitoring for cardiac patients, and we have already interacted with Philips VC arm, and we are planning to meet with them again towards the middle of second quarter this year. Excuse me. In terms of the investment opportunity, we are inviting investors. We are to be a partner in our journey. We are looking for a series seed round of $3 million, which could be structured around either a safe or a convertible note, and this would be an equity round. We would give preferred stock in exchange for capital. In terms of the use of new money, there are four key areas that would be our primary focus. First is on the product enhancements. We anticipate about 30% of our new money would be going towards that. About 55% of that would be going towards clinical operations, customer success, as well as customer acquisition, and about 15 to 20% on regulatory and FDA compliance. So, in conclusion, we are planning to, our vision is to be the de facto platform for personalized management of seizures. My contact information is listed here, and the best way to reach me is either my email or on LinkedIn. And if you have any questions, I'd be happy to answer them.
Thank you so much for your presentation. Now we will give space to the judges to ask questions, and I would like to prioritize Jan and Doreen to
Sure.
start with.
Great. Yeah, thank you so
Yeah,
much.
thank you so much. I enjoyed looking at the metrics, and I appreciate you putting this together and calculating the return on investment about 20 times over the 5 years.
Yeah.
How did you calculate that? How did you
So,
get it?
yeah. So we looked at our projection, our valuation. We anticipate, of course, it is based on the multiple, I would say, our revenue projections that we have, with the very conservative set of valuation assessment. We have every dollar that you spend now could get anywhere from 20 to 50x return for the investors. So, of course, we can take it offline, but there are multiple ways in which we have come up with that estimation. And since we are pre-revenue, some of these projections of our valuation are highly dependent on the projections of our financials.
Yeah, thank you so much for this. I really like your idea around creating this 360-degree view for the patients and creating a holistic treatment plan for that patient. I think this is really what we need more in healthcare. I have like three questions. The first
Sure.
one is the simple one. Are you providing your own devices, or which device data are you using?
Yeah, good question. So we are device agnostic. So we will work with smartwatches like the Apple Watch 6 and above, or this is what our MVP is based on right now, because we went native on iOS. Our plan is in the next release to go with the Android-based systems as well. In terms of the other devices like the wearables for EEGs or brainwaves or the sensors, so we will work with the sensor technology, the best of the best that's coming out from various research institutes and organizations. Empatica, Epitel, Zito. There are many such devices that are FDA cleared for detection of seizures. However, most of those devices, though they have very good technology, they are essentially one-trick ponies in the sense that their sensors can detect a specific type of seizure. And what we would like to do is use any combination of those variables, and as those devices become better and better, the data that we capture will definitely help us in better reporting the detections they make. But most importantly, what good is it if you have detected a seizure if you're not able to improve the quality of life of a patient or enable the neurologist to be able to say, you know what, I can now detect that there is a tachyphylaxis that had set in 3 weeks ago. Or I can now guide my drug titration so that, you know what, I do not need to spend a trial and error process of 6 weeks to realize that a drug titration is not working. And this is, from my experience as a parent of a child who I lost, unfortunately, to epilepsy, I've seen that best of the best neurologists were unable to be able to create or deliver the best path forward unless they go through a titration based on trial and error. So we will work with any of those sensor devices. That's a short answer. Medical devices.
maybe one, I don't know whether we have time, but maybe
Yep.
one question. So I've seen a big challenge on these 360-degree view business types is actually the integration with the EHR data. So
Mhm.
how are you, like which problems have you been facing there, and how are you solving them?
So no, one disclaimer I want to make is I will not, we are not, we do not intend to displace any EMR EHR system, and we are not here to replace the neurologist. Number one. Now, in terms of our integration, we are interested in selecting and maybe crawling some of the EMR EHR databases to get information associated to a patient's health related to epilepsy. For example, comorbidity related aspects, which the neurologist says that I feel that for a patient X, Y, and Z who has certain types of epilepsies, I really feel that the type of drugs or other medical underlying medical conditions are important to know, and they will select what data we need to bring in. So we will not. We eventually, maybe next year, we look at bidirectional interoperability, but that's not a primary focus for us. We just need selected information from EMR systems as per guidelines from neurologists. Did that answer your question?
Yeah, I would be wondering. So are you integrated right now, like
No.
with
No.
which
Yeah.
EHR?
No. So
Okay.
right now, and this is upon the guidance of our experts from the neurology space as well as from the compliance space also, it is not necessary. All I need to do is I need to be able to get underlying conditions that impact the ability of a patient to respond to a drug, or which complicates seizure management history. Only that information is required at this point of time for us.
Thank you.
Wonderful. Thank you. Thank you so much.